Hi, I'm Dr. David Hill, and today we're going to talk about how to give cholesterol drugs to children. Now, the first question should be, why would we give cholesterol drugs to children? We know that heart disease and the vessel disease that comes with very high cholesterols is a lifelong process. So we often start screening children about age 10 if they're overweight or have a strong family history of heart disease or vascular disease to see if they might have a familial form of very elevated cholesterol. In children who do have an elevated cholesterol, what you do next depends on how high it is. Some children may respond quite well to dietary therapy and exercise. Some children have a cholesterol that's so dramatically high that we're concerned they have an inherited form of high cholesterol and may indeed need to be treated. Who guides that treatment? Well, we usually use a specialist known as a pediatric endocrinologist. These are the doctors who best understand the cholesterol medicines and how they might be used in children. Now, we don't have tons of experience with using these medicines in children. We don't have a generation of people yet who started taking cholesterol medicines when they were 10 and then got to be age 50. So what happens in the long term is still a little bit of a guess. That said, we do know that people who go their lives with extraordinarily high cholesterol levels untreated are at very high risk for serious vascular disease, not only heart attacks, but strokes and kidney failure as well. So we have good reason medicines in children who are at highest risk. Now, the medicines come in a couple of different categories, and which category of medicine to use is going to depend on what kind of high cholesterol your child has. Some families have very high levels, for example, of triglycerides, where there is one set of medicines that helps with high triglyceride levels. Other children may have very high levels of low-density lipoprotein cholesterol, LDL cholesterol. Other medicines help with this. Some people will have a mixed disorder. Figuring out which medicine to give for which cholesterol is the sort of thing that the pediatric endocrinologist is very good and experienced at. So that is a decision best left in that doctor's hands. Now, once the medicine starts, the doctor's probably going to want to check your child's liver functions and cholesterol levels from time to time to make, first of all, sure that the medicines are not harming the liver in any way, which some of them have a potential to do, and also to make sure they're actually working. So your child's doctor will probably adjust those medication levels. That may be done in the primary care doctor's office in consultation with the endocrinologist, or it may be done at the endocrinologist's office. So, how do you give a child cholesterol medicines? However the child's endocrinologist tells you to. Talking about how to administer cholesterol medicines to a child, I am Dr. David Hill.